First time at Smartlabs, so thanks to the organisers for having me. The stuff that I'm going to speak about today is actually quite early on in development. This is a kind of 7-year project. We're 1 year in. So if I get invited back, we'll maybe be able to show you some developments as we go. There's a little bit of background work to all of this. We did start some of this 2 to 3 years ago, so there's some nice videos that we can show you with the virtual reality, and I'll be happy to talk to anybody afterward about specific aspects. So it is, I'm an academic, I'm a senior lecturer. I've been at the University of Strathclyde through my postdoc and through my lecturing years for about 13 years now. I started life as a chemist, and then so over time, it moved out of that kind of quantum chemistry stuff, which was a little bit dry. It was kind of interesting for the PhD, but in terms of the real world, there weren't so many sort of practical applications as I saw it. So being sort of computationally driven, I sort of ended up in the kind of systems sort of side in the last few years, and started to think about how we use our lab equipment, how we can use artificial intelligence approaches, specifically machine learning. Don't want to go maybe into too much of the detail in the artificial intelligence, but just the application across our manufacturing processes. Can we have an artificial intelligence at all our unit ops that's keeping an eye on things, letting us know if there's any issues, and maybe being able to predict the outcome of experiments before we get to that. So, I think maybe just for the cover slide up there, I'm part of an EPSRC-funded Future Manufacturing Research Hub. So there was quite a few of these launched about a year ago across the UK. We are continuous manufacturing crystallization. As the top of the slide shows. So it's not really in the kind of drug discovery kind of area, but more once that small molecule is established and how we sort of formulate that, crystallize it, formulate it, and get that into the final dose that the patient consumes. I say it's at this point, so we've got 4 years as a Centre for Innovative Manufacturing, which was the kind of previous iteration of these things. So we've got 4 or 5 years in this space leading up to this work. The digital aspects definitely came a little bit later on. I think generally within academia, I think the data and the digital is sort of an afterthought at the minute. That's definitely changing. But it's more about you get the funding, you get your researchers, you get the lab equipment that you need and the kind of consumables, and then it's, what are we going to do with the data? So, we're trying to sort of rethink that a little bit and make sure now that, as we develop a lot of these new continuous manufacturing processes, that the digital aspects are done at the exact same time. It's not a kind of bolt-on, and that we do it sort of at the same time. So, I say it's a multi-centre. Strathclyde, where I'm based in Glasgow, is what's known as the hub, and we have spokes around about us. So we've got Bath, Cambridge, Sheffield, Imperial, London, Leeds, Loughborough are the other kind of spoke academic partners. So there's a good breadth of experience in the formulatory and the manufacturing space. We've got chemists through chemical engineers, right out through formulation scientists, pharmacists. So, it's a good skilled mix. And all of these guys have got, a range of PhD students that are kind of working with data, and we're trying to sort of educate in the kind of data aspects of things. So none of this would really be possible. So the EPSRC, have put a lot of money into this, by their sort of standards, but a lot of the kind of financial support and input also comes from a lot of the tier 1 partners along the bottom. So a lot of the big pharma companies are well represented as our tier 1 members, and so they have quite a significant financial contribution. We also have a raft of very important tier 2 members as well. They sort of bring in kind contributions more, so access to software, models, expertise, and that really sort of makes the whole project tick. So this is CMAC is a 7-year project. We're 1 year in, so a long way to go. But the idea really is that we start with this API or drug molecule, and what we need to do is to get that to the patient. So by using predictive design processes, harnessing data essentially across the whole process, what we want to do is to accelerate from say the drug molecule out to the final form. So there's research. We've got a doctoral training centre, so we've had about 100 PhD students go through our books at all of these universities. And part of that, is educating those guys and getting that data science skill set right for those. And I say when they go off to the industry partners, these guys always feedback that, it's great to have that kind of skill set. So I know it's something the UK is conscious of. We don't, universities aren't particularly great, I think, at giving the young guys a lot of these computational skills, the design of experiments, the multivariate analysis, just, the kind of basics. So we're looking definitely to improve that over the coming years, and hopefully that then has a knock-on effect to, you guys in industry. Just to kind of put it into concept, a lot of the kind of current manufacturing of pharmaceuticals tends to happen in kind of batch reactors. So these are, kind of a 4,000 litre capacity reactor. You put your ingredients in, you kind of cook, and you get your product out. The approach that we are going for is a more continuous approach that tends to be smaller volumes. You get these kind of glass reactor lines, and these snake backwards and forwards, and basically all your drug crystallization happens on the small scale, but it's happening continuously. So the thinking is that if you run one of these lines 24/7, 365, that you can get as much drug out as you can by running these larger vessels, and then these things tend to have a little bit more in terms of the overheads. If something goes wrong, you've got to clean it out, start again, and there's more wastage. Here, if something looks like it's going wrong, you can stop, fix, and you don't lose anywhere near as much material. So I've kind of used a kind of versus as if these things are kind of fighting each other, or that we're trying to switch over. I think the reality is that continuous will probably suit certain products rather than others, and that it'll definitely be a mix of the conventional batch versus continuous manufacturing. But all of this is relatively new. How you control these processes and get the most out of them is very much where our research is at. So the pharma industry are obviously keen to see how we go with this. In terms of the data that we've got, again, the kind of scales that we're working on, we've got from the molecule down at 10 to the minus 9, so you're on the kind of nanoscale with your molecular data. And as you sort of go through the workup, you start to go crystals. You get to this point where you're suddenly at a centimeter-sized tablet. And then really, that's not the end of the story for CMAC, because we're also interested in how all the supply chains work, beyond that. So, how do you get these medicines out to patients? And a lot of that's not kind of my area of expertise, and the guys at Cambridge look after that. But, here we're looking at global supply chains. So effectively, you're up at thousands of kilometers, so 10 to the 6 meters. So what we're trying to do is harness data over 15 orders of magnitudes, and somehow use that to train artificial intelligences that can keep an eye on all of these aspects of the workup and development. In 6 years, are we going to be able to do all of that? Have an artificial intelligence that can basically oversee all of this? It's pretty unlikely. I think it would be very ambitious if we thought we could do that. I think. I'm going the wrong way. I think if we can get from the molecule up to the tablet and have machine learning sitting at the unit ops as we get out there, I think I'd be pretty pleased at that. And we've got some examples where we are able to train an artificial intelligence to sit and observe data and to predict faults, other kind of things like this. So that's kind of where we're at. So the first thing, excuse me. One of the first things that I was kind of aware of was that we needed to capture data, and say industry have been using electronic lab notebooks for decades, but certainly within academia, this is just a technology that really hasn't been embraced. Universities, for all that they're kind of very fundamentally data driven, that's the science. We're very old-fashioned with regard to how we collect data. It's all paper and pen. You'll find very few universities that actually use electronic systems. It was kind of interesting, I think, yesterday, the kind of comment about the upcoming generation being very happy to move on to these electronic systems. From experience, that's actually not how we've found it. We've got new PhD students coming through the system every year. These guys are very adept on smart devices and things, but even for these guys, they're very much like us. It's the path of least resistance. So if a bit of paper and a pen, turns out to be the easiest solution for them, that's the way they're going to go. These guys are doing PhDs. They've got a 3-year, 4-year sort of horizon. they don't particularly care about, the person that's 2 years behind them, other things. So, the digital thing won't sort of just happen, because times are moving on. It does need effort. Even though these guys are quite happy to get on and use the system, they're quite quick to work out if the system's, working for them or if they're working for the system. You need to get that right. The systems really need to do their job, or I say no one will be interested. So the first thing was, this ICT platform, and we had an ICT CMAC project, which was also EPSRC funded, and led out of our sort of engineering EEE department. So we put in electronic lab notebooks, we established the databases and tried to get the links between all of that aspects. So we've got about 300 items of equipment within CMAC. There was a £15 million grant award was made to put the equipment base in. So there's a whole floor of a building dedicated to the continuous manufacturing aspect. Lots of new cutting-edge equipment. We've got about 100 researchers as part of CMAC. So, again, relatively small workforce compared to what some of you guys will be working with. But for an academic grouping, 100 people is quite substantial. And I say we've got Strathclyde as the hub, and then 6 spokes round about us. So, I say we've got to have a system that can work across site. So we looked at various platforms. Coming from a modelling and a drug discovery background, I had always been quite familiar with Accelerus and then Biovia latterly when they sort of changed products. So we ended up with the Biovia notebook, which was quite a lightweight web client. My thinking really on that was that I wanted something that was really stripped down. We didn't want one of the kind of old school interfaces with buttons everywhere that just confused people. We just wanted something that was kind of simple and functional to start. And the fact that it was kind of web-based, it just suited the mobile devices and the way that we tended to work in the offices. What we did, though, pretty much in day one was to integrate Pipeline Pilot, which is another Biovia tool for handling the workflows. And we integrated the workflow engine directly into the electronic lab notebook, so that we basically had one front end for all the work that the guys would need to do. These workflows would be sort of bespoke to the individual researcher and made available. So you would run the workflow within the ELN. It would go off, analyze the data, generate the report, and then the report was just inserted back into the electronic lab notebook as part of the experiment. So there's really no kind of loss of data, and we keep everything together. So this idea of the workflow is kind of fundamental to what CMAC does. CMAC workflows are something that we've spoken about from the beginning. To actually make the workflows is actually quite an involved process. We've got 20 plus people worked on this is a cooling crystallization. So this is, you take your solution with your drug dissolved, you cool it, and the crystals start to precipitate out. So this is a cooling crystallization workflow that we actually developed for continuous manufacturing. So it's kind of a relatively new space. All of this is new. And so this is part of a paper that's just going to be coming out probably in the next week or two. This should be live online. So I don't think we've published in here. So if you search for Cameron Brown on that journal, so you should get that. If it appears in the next few days, I'll update the slide before they're made available to you guys so that you can find it a little bit more easily. But I say there's been 20 plus people have developed that physical workflow. And at the whole time, for each of these stages of the workflow, we're thinking about the data. What equipment are we using? What are the input parameters for that? What models are we using? What are the inputs for that? What are the outputs that come out of all of this, so that we can stitch it all together? So for each one of these boxes, we've got multiple Pipeline Pilot workflows then sitting, pushing the data from one box into the other. The other nice thing about all of this is, we've got the kind of data kind of modularized, and then we can use that to feed the machine learning and artificial intelligence approaches to then make predictions. So based on work that we've done at stage one, and artificial intelligence will take that information and then be able to work out, well, here's what you should do at the next stage. Here's how you can optimize things to make your process more effective. Lots of work to do, so the framework's there, but what we need to do is we're going to have an awful lot of these to build up over the next 6 years, and then all the work that goes into the kind of digital and making sure that, I say, that happens in tandem, and that this isn't an afterthought and a kind of, we'll bolt it on and worry about taking all that kind of old data and trying to sort of retrofit it. And I say it wants to just go live at the same time. So we've also got all our equipment. So there's about 300 items of equipment, and we've tried to use the Open Platform Communications, OPC, protocol to link or to capture a lot of that data as best we can. In some instances, that's, the particular piece of equipment might not support that, or it's just a little bit awkward. And in some cases, we'll use the vendor software to manage the data and to get that centralized. Ideally, we're just trying to ensure that everything gets captured and that we don't lose anything. Again, within an academic environment, files end up all over the place. It's just an absolute mess, to be honest. So, we've tried to be kind of proactive about it. It's not quite as good as we could be. I think a lot of the metadata that we need from a lot of the equipment isn't as it should be to make things searchable further downstream, but, we're on the right direction with that. We're also one of to sort of mention the name drop, the Allotrope again, we're one of the Allotrope partner network, and we've been involved for, I guess, a little bit over a year and kind of keeping track on the Allotrope Foundation. It's certainly my intention to make as much of our data available in ADF format going forward. And say we're funded by the Research Councils UK, so all of our data needs to go public domain, or a large chunk of our data will need to go public domain. We do have some proprietary projects that will need to be kept under wraps with a lot of our tier 1 partners, but any data that goes out, I'm hoping we'll be able to get into the ADF format to help show the power of having that sort of one format for everything. I just, to say to Janet and the team while they're in the audience, I think the work that you're doing is really spot on. It's really timely, and I'm hoping that, a lot of other people take a good look at the Allotrope Foundation and the work they do, because it is a significant piece of work. So all of this data, all the stuff from the equipment, brings us to this idea of a kind of digital twin. Again, the terminology is definitely going to start to appear an awful lot more over the coming years. The UK government have kind of got their head around this in the last 12 months. And they're starting to think about what this is. So, it's an enabler to innovate and manufacture faster to meet customer demand and reduce that risk, reduces time to market, streamlines all of this stuff. So, this idea that we take the kind of physical equipment and assets and that we build digital models of those, essentially we can simulate all of our processes. So using all of that data that we collect, feeding that into these models, so we can work out what's going to happen before we go and spend any money in the labs. So we've already kicked off a lot of this work. I'll say these are actually 3D models. They look like a photograph. They're that realistic, but these are actually 3D models of the lab equipment, and we're starting to take all the sensors and data that we've got to make these models interactive, so that you can look at them in an augmented reality environment, see what temperature the glassware's at, what size are the particles at, all sorts of nice and clever stuff. Once we get all the artificial intelligence sorted, so if we've got an AI that sits on this unit op, that AI will then be able to speak to the user via the virtual reality or the augmented reality headsets. I think in practical aspects, probably augmented reality is going to be the way we'll go. Virtual reality is quite nice, I think, for training, but obviously you've got these helmets on and you don't really see much of your environment. So in a lab environment, virtual reality is probably a bit limited. Augmented is definitely going to be a lot more practical, and we're starting a little bit of work with a company called DAQRI, DAQRI, who do kind of state-of-the-art augmented reality and virtual reality headsets that are quite low profile and starting to get to the point where you could actually see yourself wearing them in a lab for an extended period of time. So your AI will be able to feed information in about what's going on and to make suggestions about how to make things better as you go forward. So again, talked a lot about this AI, and it's quite difficult. I mean, you need a lot of data generally to drive these data-driven approaches, but over the last few years, we do have certainly the unit op, so can we predict whether a molecule is going to crystallize? How soluble is a molecule likely to be? How insoluble are the impurities in that drug powder likely to be? How many different polymorphs are we going to get as that drug crystallizes? So we've been able to train machine learning models, based on incoming data. We've trained them to be able to predict, what's going to happen. And again, the potential there is to save a lot of money and time in the lab before, by doing a lot of this work. So what we need to do is, I think we've been able to prove, at the kind of unit op level, we can do that machine learning. The next kind of trick is going to be to try and integrate all of that into a kind of overarching artificial intelligence that can see, absorbs all that expert knowledge from a range of different scientists, and then is able to harness all that information to be able to tell you about or optimize your process overall. We're obviously going to try and work up a lot of the kind of virtual reality, augmented reality aspects, how we deliver all of that complex data out to the end user is kind of going to be quite difficult, and I think the augmented reality is probably going to be a nice way to do that. So this is the 3D models that I kind of showed you on the previous slide. These have been scanned by Glasgow School of Art, so we've got a collaboration with the Glasgow School of Art, and they've got a fantastic team at the School of Simulation and Visualization. That's their Twitter there. And these are actually, when you look at them in a virtual reality environment, they are like very realistic. They're scanned to 0.5 millimeter resolution, so all the kind of scuffs and the logo, the little bits of dirt, they're actually on those virtual models, and they're very convincing. I've actually seen somebody fall over trying to lean on a bit of equipment in the virtual environment, so they are very, very convincing. So we'll take all our data and we'll be able to overlay onto that equipment. You'll also see I've got a kind of pop out on that virtual reality display for ULab, which is our equipment management system, which we've developed at Strathclyde. I've got 5 minutes, I'm being warned, so I'll maybe talk a little bit more about ULab quickly before we wrap up. I've got a video in here of that VR environment in operation. It's actually, it's captured with somebody moving around, so it can make some people a little bit motion sick. If you want to see that, well, maybe I'll skip it just now, just for the sake of time, but you can grab me after the presentation and I'll let you see how some of that data feeds into the environment. Just to talk a little bit about ULab. ULab was this is slightly off on a tangent, but it is as a platform that we use within the CMAC project. ULab's a project established in 2012 at the University of Strathclyde to help us manage our equipment more effectively in our labs more effectively. Basically, you go through a university building and you'll see quite a lot of empty labs, and you'll see a lot of equipment that's sitting looking pretty unused, and that's across the board. All universities tend to be the same. Generally speaking, what we found, the more expensive your piece of equipment is, the less it's going to get used. Obviously, these things are more complicated and tend to get, you need more expertise to drive them, so you can understand maybe why they're used a little bit less, but you can have nearly £1 million pieces of equipment with about 10% utility, or possibly even less, actually, in some cases, which doesn't really, you're not getting value out of that equipment. So what we thought we would do was to design a tool which let you, manage your labs and make that equipment visible to users, within your organization and potentially within, out with that organization. It's quite often the case, especially within academia, that there's a bit of equipment, but it's just 2 labs down, and you won't actually ever know it exists. You'll go and you'll purchase your own bit of equipment, and you say you could have gone and spoken to somebody and used theirs. So you can say, if you want to have a poke around at ULab, you can get it at ulabequipment.com. At the minute, I say we've got about 1,700 users at Strathclyde. There's just a little over 2,000 users on the system across mostly Scotland and the UK at the minute. I would say that none of this has been, we haven't forced anybody to use this system as we've developed. This has all just been through word of mouth that people have actually come on to the system and started to use it. So, it's obviously useful enough that, people are picking it up without being forced. We've got a few thousand pieces of equipment on and about 350 labs at Strathclyde. We handle around about 2,000 equipment bookings per month, so we've got equipment calendars that allow you to schedule when people are on your equipment. And in the last year, we've had about, I think we're just about to hit 1 million page hits at Strathclyde and within Scotland in 2017. So we haven't pushed this out beyond Strathclyde. It's just kind of word of mouth, kind of crept out there. We are making the platform, openly available to everybody. So do feel free to have a look. If you do want to register, it's only academic institutions, by and large, that are in the organisation pull down. If you, from a company perspective, want to look at it, if you email me, we'll make sure that you're added to the organisation list so that you can register for that. But we've got hits. Some of our guys have gone off to the CMAC, researchers have gone off to the States, Canada, and further, and they've taken the system with them. So, we've got hits now coming in kind of globally with people putting their equipment onto the system. Here's some of the, the institutions, certainly within the UK, where we've got users. These guys haven't signed up as institutions, but we do have researchers at these places using the system. All the chemistry departments in Scotland, they come under the banner of ScotChem, so ScotChem have picked it up and used the tool to let researchers in other departments see what's in the chemistry department's labs. So just quickly, we've got tools. You can draw a floor plan for your lab. You can add a kind of furniture layer, so you can draw in your benches, fume hoods, or whatever else. You can then drop your equipment onto that lab and upload a picture. You can upload blueprints. So if you've got a drawing of the lab, you can upload that as your backdrop and then put your equipment down onto that lab. You don't really need to use, if you just want a list of equipment but aren't too fussed about where it is within the lab, you don't need to use the floor plans. If you just need something quicker, you can have a list of equipment. And then there's an API that lets your equipment push a message to ULab for equipment updates. So you can actually see what the equipment's doing in real time by visiting the page. We've got really quite complicated booking tools at this point. We've been listening to our researchers for about 5 or 6 years as we've developed this. We've really developed it from the ground, thinking about the researchers, and then that data then starts to become valuable to the research funders and to the institutions, but it's been driven from the ground up. So you can set, who can see your equipment. Is it just your own group? Is it other people within your university, your organisation? Is it, the whole world? You can set that any way you want. You can set, when your equipment's available to be booked, who can book it. And, there's quite complicated set of rules around that. We've even got charging tools in there, so you can have costs for internal usage, costs for external usage, and kind of other things. This basically makes it a lot simpler to set things up. You've got your lab diary, so people can go in, book time on the equipment, and you can see on your lab, when the equipment's been booked, and start to move things around if you're the lab manager. If you move things around, then anyone who's made that booking gets automatic emails to say, oh, your slot's been moved, your new slot's at such and such a time. So again, there's quite a lot of useful tools in there at this point. And then in terms of promoting your equipment, I say you can put your equipment in. So if you scan any of these QR codes, you'll actually go to this page. You can see what the equipment does. You can have an institutional kind of landing page within ULab, so each university can have its own page. So if you go to the Strathclyde ULab page, you'll find the EPSRC CMAC Centre. You click on that, and then you'll come to a landing page within ULab where the research themes within CMAC are kind of more visible, and you can click on those, and you're sort of searching within equipment within those sections. Sometimes people don't know, if you're a company, maybe you're looking for a specialised bit of equipment, you maybe don't know the exact name of the equipment, but roughly, what you need to do. So, being able to search under kind of theme, makes that certainly a little bit easier to do. So hopefully, say we've got 5 or 6 years of developing this. It's pretty mature at this point. If you want to have a look at that, feel free. We've really thought more about the academic market, but we do have some companies, smaller companies that have been interested in managing their equipment with it. We need to kind of monetize this at some point, so we are in the process of looking at spinning this out. My kind of feeling about it is that I want it to be free for researchers so that I can gather that data. So if I can make it free for the researcher with the lab, they can put their equipment in, they can have the diary and everything else, and then charge, for the aggregated reports over the institution, so kind of make the institution pay for that, but have it free for the researchers. That way we can start to build the user base, get the data in, and I guess it then puts more sort of impetus on the universities or whoever else to pay for the reporting on it. So just to wrap up quickly, if you want any information on the CMAC project, our director is Alistair Florence, he's the academic director, overall director. Craig Johnston is the industry director, so if you're kind of coming from an industry background and interest, speak to Craig. Any of the ICT, digital, machine learning stuff, feel free to email me about that anytime. With ULab, there's just 3 of us that have been involved in that. I guess it was my idea in the first place, and I roped Tim and Ian in. They are the developers, so we're going to be we're in the middle of founding ULab as a spin-out. So if you've got any questions about that, or just want your organization added so you can have a play around and have a look, if you email one of us, and we can usually do it within 10 minutes and get you fixed up. Okie doke, thanks for the attention. Take any questions.
Thank you very much, Blair.